So aortic stenosis is a disease of the valves of the heart. We all realize that there are 4 valves in the heart, and they're responsible for directing the blood flow in a manner that it only flows on one side. Aortic valve is the main valve between the left ventricular cavity and the rest of the body, which is responsible for making sure that the blood from the heart goes to rest of the body parts. When the aortic valve is narrowed, and that may happen because of age or many other diseases, the condition is called aortic stenosis. Now, aortic stenosis is also an aging process whereby this valve, because of aging, has a lot of calcium being deposited on it over a period of time. And as age goes on, the valve, which is supposed to open normally, does not open normally and gets narrowed to the extent that it doesn't allow blood flow to pass through from the left side of the heart to the rest of the body. This is called calcific aortic stenosis, and it's a disease process of aging and elderly. Nearly 4 to 5% of people of the population above the age of 75 has calcific aortic stenosis, and this condition of aortic stenosis may also affect the younger population, especially those with congenitally deformed valves called bicuspid valves, or even in those conditions of rheumatic fever which has affected the valves of the heart, leading to thereby aortic stenosis at an earlier age. The important aspect to understand is that while on one hand we talk about coronary artery disease a lot, we must remember that valve disease, including aortic stenosis, is also a life-threatening condition. When we transfer those numbers of 4 to 5% of the adult population or aging population of more than 75 years, we're talking about lakhs and lakhs of patients suffering from calcific aortic stenosis. Aortic stenosis itself presents, and may go unnoticed by the way, but usually presents as breathlessness on exertion, may present as chest pain or discomfort on exercise and walking, may present as sudden loss of consciousness and fainting because the blood circulation to the brain is decreased, but rarely is life-threatening, and also can have patients with severe aortic stenosis can have sudden death. In fact, one of the commonest presentations of aortic stenosis is that gradually the strain on the heart becomes so much as the heart is trying to pump blood out of this narrowed aortic valve to the rest of the body, that the heart gets tired, it dilates, it expands, it becomes weak, and heart failure sets in as the pumping efficiency of the heart goes down. And that leads to what we call congestive heart failure. So it is a condition which kills people. Early diagnosis is important in this condition because it is life-threatening, can lead to sudden death, can lead to heart failure, can lead to low ejection fraction, and therefore can harm the heart. So early diagnosis not just saves complications in these patients, but also saves lives. That echocardiography, which is just an ultrasound examination of the heart, echocardiogram, which is a simple test, an inexpensive investigation available practically in every city, will diagnose aortic stenosis with ease. For many years, the treatment of severe calcific aortic stenosis used to be an open heart surgery. What we call put the patient on a bypass circulatory pump and then cut the old valve out and put a new valve and sew a new valve in. But over the last 20 years, that has revolutionized into a simple and easier procedure, which is called TAVI, Transcatheter Aortic Valve Implantation.